Hello, AMP Honors Program. I'm back after my 1-week hiatus for another quick video about my clinical apprenticeship. I'm in my favorite tie. We had an interesting case today. It was especially interesting because we've been talking about the upper extremity in our anatomy class right now, and this happened to be a left wrist pain. So it was a middle-aged guy who had like 6 to 7 weeks of left wrist pain. He noticed the pain the most when he would extend his wrist, and also when he loaded weight on the wrist. So like in a push-up position, that was when he noticed the pain the most. And he was a big yoga guy, so he is in that position a lot, as the yoga masters know. He'd been using, he said, ibuprofen and ice pretty religiously to try and get the pain down. And he said the ice, putting his hand in just like a bucket of ice, has helped the most, but still it hasn't really knocked it down all the way. So he had like some swelling on so it'd be the volar, which is like the palm side, and then the ulnar side, which is kind of by the pinky. It was right on his wrist, kind of where my wristband is covering over. He had like a big, like it almost looked like a small like ball of swelling. It was relatively mobile when you kind of palpated it, but what we thought it was a ganglion cyst, particularly a volar ganglion cyst, which is basically just like a fluid-filled covering over like a tendon or joint. You'll commonly see them on the like back of the wrist, like a big, like it's hard to, kind of where my wristband still is, but right on the back of the wrist, and they'll just be kind of like little hard like marbles almost in the wrist. And we thought that was probably the reason for his pain, and my preceptor kind of suggested a bunch of different options and let the patient decide, which is a cool thing that my preceptor does a lot, that I think goes a long way with giving the patient kind of the control over their care. So he said they can definitely do an MRI to do some more like diagnostic tests and maybe to rule out or rule in a ganglion cyst. He also said it's common to surgically remove them, and it's a relatively quick surgery. It's not really a big issue. It's just kind of like local anesthetics, and it's a quick one. He also said if it for sure is a ganglion cyst, you can sometimes aspirate them with like a needle. You kind of just like poke a needle right in it and like decompress it, and like the fluid will come out. But he said that a lot of times with that, it'll come back and it won't fully fix the problem. And then he also offered just kind of the wait and see approach, which is eventually what the patient decided on. We recommended that he use a splint at night to keep it stable, because my preceptor said that a lot of times at night we kind of flex or extend our wrists for long periods of time when we're not really conscious of it, and that can lead to kind of more morning stiffness. And then he also mentioned range of motion exercises, kind of like physical therapy type stuff, try to get some of the fluid moving out. But anyways, thanks for watching this week. It was great to be back, and unfortunately I won't have another clinic apprenticeship for the next 3 weeks because we got exams. Again, thanks for watching, and I'll see you in a couple weeks.